New research suggests the risk of developing dementia is higher than previously thought. According to a new study from NYU Langone Health, roughly 2 out of every 5 people over the age of 55 in the U.S. will develop dementia. Researchers project the number of people diagnosed with dementia each year will roughly double by 2060, when approximately 1 million Americans will develop some form of cognitive decline. Much of this trend is driven by baby boomers who are reaching their later years, as well as the shifting racial makeup of the U.S. population. The study, reported in the journal Nature Medicine, found significant racial disparities when it comes to dementia risk.
Joining us now to talk more about this is Dr. Han Lee, a neurologist with Kaiser San Leandro Medical Center. Doctor, thanks so much for the time. Why is the risk for developing dementia so much higher than we thought it was?
The study basically looked at a larger group of people in the United States. It's a more modern look at what our patient population looks like. They also looked at more diverse races in the United States, and they also projected to 95 years old. So we're hypothesizing that humans will live longer and longer over time, and so the risk goes up and up and up.
What does this study tell us, and how would you sort of describe the risk of developing dementia that this study is laying out? How significant is this?
I think it's significant in that it is a warning to us that we need to take this very seriously, and that we will be facing a significant portion of the human population with dementia. And so I do think of this as a warning. I also think of this as a beacon of hope, because we do know that there are modifiable risk factors, meaning that there are things that we can do in our lifetime to reduce that risk. So I think on one hand, it does sound a little bit scary for some people. But on the other hand, if we invest now in our health, we could potentially change the future.
Doctor, you mentioned how this study goes deeper into the racial diversity of patients here, and that found striking differences in dementia risk, specifically for Black Americans. And this is something we often see across the board with health disparity. But why are those dementia rates such a stark difference when it comes to racial disparities there?
Yeah, in the past, we excluded a large swath of the U.S. population in our studies. And now what we're seeing is that we're seeing the African-American community participating in these studies, and we're finally seeing that their risk factors, things like depression, blood pressure, diabetes, cholesterol, these things are really impacting and increasing the risk over time.
Can we talk here about sort of the big picture of what this means more broadly for all of us, sort of the burden that is going to be put on society as a whole to care for a growing number of older Americans who are dealing with cognitive issues, dealing with dementia? Do we have the systems and the services and the resources in place to handle that? And if not, how do we prepare?
I think we do need to invest more. I think our patients will feel like they don't have access to the experts they need in order to get the best care. So what that means is that we need to be proactive with our community, our government, convincing our leaders that more investment needs to occur, because it affects all of us in the future. If either 1 out of 10 Americans will develop this over the age of 65, or you will know somebody in your lifetime that will be afflicted with this disease, and you have to take care of those patients. And so this is going to affect all of us. It doesn't matter who it is. And so we need to invest together.
Doc, you alluded to these sort of actionable items. So for people that are watching now that may have this in their family, what can they do to lessen the risk of developing dementia? Yeah,
this percentage of 42% sounds very scary, but I do want to give out another percentage, which is 45% of the risk factors in dementia is modifiable, meaning that you can change your life to reduce that risk. So you could either be in that 42%, or you could be in that 58% if you change certain things like preventing traumatic brain injury, make sure that you're physically active, stopping smoking, taking care of high blood pressure. These are things you can do. And so I want to be hopeful that if we enact these things in our life, we can change this percentage and we can change our trajectory.
Yeah, really important perspective. We appreciate the time and the insight. Dr. Han Lee, neurologist with Kaiser in San Leandro. Good to see you, doctor. Thanks for the time.
Pleasure.